Hi, everyone. We were supposed to start with Tamiris, who I want to say thank you for organize everything, and thank to our people. And for sure, it's always a technical problem in the beginning of all these events, but I want to say thank you to everyone. So can we share the presentation, please? Okay, so again, I want to say thank you to all the speakers, Naércio, Agatha, Karina, and Guilherme. We'll be all together in the end of the presentation. And let's give you an overview about Abrinq Foundation, Fundação Abrinq. Abrinq is the Toy Manufacturing Association, so it's connected to the business, and they decide to start a foundation 33 years ago. For sure, toys, children, and so they're connected. And they start this foundation to help kids from 0 to 18. Why? Because we have lots of problems in Brazil. We are going to talk about some here today. And we started, was in Brazil like 8 million children in child labor. And now the last number that we have is 1.7 million. So we still have lots of children working every day. And after the COVID, we suppose it's 2 million. So we are waiting for the new numbers, but it's still a problem in Brazil. We still have problems with access to daycare centers. We have like 50% of the families headed by women. So they need the daycare centers, the nurseries, and they all have 30% the access to those services. And we still have like 100 children between 0 and 5 dying every day in Brazil with preventable causes. I always say that it's like a plane falling down every day with 100 children inside, and it's not new. And we have other problems here: violence, children under 8 for their age. We're going to talk about this today. So Abrinq Foundation, we work as a bridge between who those need help and those who wants to help. So we don't have children here. We support more than 200 NGOs all over Brazil, and we connect people, companies who want to help. So they give us, we have more than 50,000 individual donors, more than 5,000 companies supporting us to help children all over Brazil. And we have in our constitution all the rights in the Article 227, but we focus in education, health, and protection. When we talk about education, it's a huge area. So we talk about access when you talk about daycare centers, and we talk about quality in all over the basic education. Combating child mortality, as I said, we had this huge problem. Protection, so combating child labor. We work not only us, but we have some committees and companies and other NGOs to combat child labor. And emergency, we come back to emergency and some activities giving food all over Brazil as food baskets. How we work? Implementing programs and projects. So this year, 17 different programs and projects here, all connected to the SDG goals. Mobilizations, so we talk about some campaigns against child labor, against violence. August, breastfeeding to improve this, which is very important. Producing dissemination of knowledge. So we produce knowledge, and all the documents are on our website in PDFs for free. So you can go there and have all the information you need. and for sure advocacy, so to improve new laws to help children all over Brazil. And to work, we need data to know where the problems, the size of the problems, and where can we help regions, and which kind of help we can provide. So we have this connect to SDGs, the childhood and adolescent scenario in Brazil every year. You can use the QR code to download this document. For sure, it is in Portuguese, but you can use the Google Translator to read this. You can have the PDF, it's the QR code. So it's in the 10th edition of Child and Adolescent Scenario this year. And talking about this scenario, and so I'm not going to talk about every SDGs, so we have our speakers to talk about this. There are 17, 10 are related to children. I'm going to just give you highlights in 5. So the number 1 is poverty. We have millions of children living with $2 a day. And for you who don't live here in Brazil, it's like only you can just pay 2 buses for tickets, for example. So we need to work in some way out. So now we have the cash transfer, which we call Bolsa Família in Brazil. And the growth of the economy, employment, it's another way to improve wealth. And education. Education it's a huge solution. We need to have a pact to have education here in Brazil. For example, which year in the school you can increase 10% of income as an adult. Another one talking about children and zero hunger. We have like 30 million people in hunger in Brazil. So children are suffering the consequences of this. More than 1 million having problems with their short weight for age, low weight for age, and the high for age. So you put everything together, more than 1 million children. 9 million children depends on the meal at schools as the only meal of the day. So you can imagine in the COVID, in the pandemic, without schools, the huge problem that we are facing. Health, the SDG number 3. So talk about infant mortality, increased because of COVID. So, but again, preventable causes, and we have some activities here in Abrinq Foundation, the west of Bahia, and we know that's possible to increase and to improve activities, public policies to prevent those deaths. Other terrible index in the SDG 3, maternal mortality, and was like 80 in 2019 for each 100 lives birth. The goal is 30, and we increase it to 113, which is a disaster. We're going to talk about this later. Education, as I said, it's a huge problem. So we have schools without clean water, without proper meals, and without internet. So 6% of the schools in the north, in the pandemic, they were without the schools and without internet to improve the homeschooling, or schools at home, not homeschooling. So it's a huge problem for education that we need to improve here. And 17, we have some public policies that need to be improved in the cities, municipalities, but we have this partnership with the president. We are negotiation with them to sign this programa Presidente Amigo da Criança, so it's child-friendly president program. So we gave them this Retrato da Infância e Adolescência no Brasil, which is a picture of the children, the goals, the SDGs standards they need to follow, the results. So a panorama of childhood and adolescence in Brazil. And we are going to launch in October the 3rd, the new version. And in New York, in the Brazilian American Chamber of Commerce, with Albert Fischlo, Dr. Professor Albert Fischlo. And we're going to talk the new situation in Brazil. And we're in the middle of, we have 7 years more to 2013. So we can do it. You can improve public policies. You can put money in the budget to do this. So we are going to talk about this today. And thank you. That's Abrinq Foundation. Now I'm going to call Professor Naércio Menezes Filho. We're going to talk about SDGs 1, 2, and 4. Thank you, Naércio, to be with us.
Hello, good afternoon. Thanks, Victor and Tamiris, for inviting me. It's a pleasure to be here and talking about this important subject, the childhood problems in Brazil. And I'm an economist. I am at Insper Business School and the University of São Paulo, and I direct the Brazilian Center for Early Child Development. So all starts in early childhood. That's why we built this center, and we're doing new research focusing on development, early child development in Brazil, following a new cohort of children. So let me start by saying that the biggest problem in Brazil is inequality of opportunities. Brazil is a very unequal country, and those kids that are born in richer families are more able to fulfill their dreams and objectives in life than those born in poorer families. And mobility, intergenerational mobility is very low in Brazil. And that's very bad for productivity growth, for democracy. And so we have to start early on. We must have equality of opportunities. This was a flagship first raised by Professor Amartya Sen, and I think it's the most important issue facing Brazil now. And every child that is born in Brazil must have the same opportunity to realize her dreams and objectives in life. And it doesn't matter whether she is white or black, whether she is born in the Northeast or the North, in rural or urban area, everyone must have the same opportunity in life. And we are very far away from that, as I will show you during this talk. In Brazil, we have a lot of problems in our youngsters. So the quality of education is very low. So if we look at the international exam at PISA, that assesses learning of youngsters that are 15-year-old, Brazil is in the bottom of the list of more than 60 countries. And also the share of youngsters that are out of school and out of work at the same time reaches 25 to 30%. So we think that these problems are linked to poor early child development. The new science of early child development has shown that in the early years of life, the number of connections in the brain reach the number of millions per day. And so it offers a window of opportunity for the kids to develop their cognitive and social emotional abilities that will help them to do well in school, progress through the school without repetition, enter college or the formal labor market, or be an entrepreneur. But if there are periods of toxic stress brought about by extreme poverty, by hunger, by domestic violence, by lack of sewage, and all this will act as an inhibitor of early child development and brain development, as it should be. And so the problem is that in Brazil, we still don't have the basic conditions for child development. We made some progress from the last 30 years. 30 years ago, we didn't even have a public hospital, a health system, a universal health system. We didn't have universal education. We didn't have transfers, cash transfers. Nowadays, we have all that. But still, 2/3 of Black kids between 0 and 6 suffer from at least one of these problems: extreme poverty without cash transfers, lack of sewage, or living in poor conditions, in extremely packed houses with more than 8 people living in 2 bedrooms, or sewage, which is amazing. About half of our population do not have access to basic sewage conditions. And the cash transfers, although are very good and necessary, sometimes do not reach the poorest of the poor in Brazil. Therefore, with these poor conditions, it's very likely that these kids are not developing to reach their full potential. And this is the basic foundation of the huge inequality that happens in Brazil. And so, what can we do about that? Focusing on early child development, you have to have policies that are intersectorial. So that's the difficulty of solving the early childhood development problem, because you have to act on several fronts. You have to have programs on social policy, social assistance. You have to have programs in education, and you have to have programs on health. So let me talk about each of these in turn. In terms of social assistance, we have to have programs that increase the value of the transfers for family with little kids, with kids from 0 to 6. So fortunately, the new government has introduced changes in our main conditional cash transfer program, which is Bolsa Família, exactly in this direction. So families that have young kids have 200 reals more per month. I don't think that's enough. So I would like to see an increase in the value of the transfers for family with small kids, and a decrease in the basic transfer, so that on average we have around 600 reals per family, but with higher values for families with kids. In terms of health, we have a very good national program called Family Health Strategy. It's a program that was developed in the 90s, following the new constitution and in the context of the SUS, which is our universal health system. And this program provides visits for households, especially poor families across Brazil. So once a month, each community agent community health agent goes and visit even the poorest of the poor families in each state and check out the basic health conditions of all the members of the families and gives advices, and in case of more serious problems, direct the household members to the basic clinics, what we call OOBs in Brazil. And this has been a very successful program. There was the program impacted mortality, decreasing mortality in the regions where it was introduced earlier, and also decreased a whole set of health conditions. But the program has to be increased, and it must contain agents that are specialized in early child development, so that they can also understand what's going on with the kids in each household. That's very important. It's not straightforward to measure child development. So we have to have agents that are specialized in this program. Moreover, we have the problems of education, as it was mentioned before. Not all families that would like their kids to be in nursing schools are able to do so. So there is a lack of supply of places in daycare centers in Brazil. So the share of kids from richer families that go on and have a place in early education schools is much higher than the share of poor families that are able to do so. And we're not mentioning the quality either. The quality of preschools or nurseries attended by rich kids is much better, much higher than the quality of the nurseries attended by the poor families. So this gives rise to inequality. This reinforces inequality. So the way forward would be to focus on early childhood. Since birth, we have to try as much as possible to equalize opportunities. We have to increase transfers to poor families with kids. We have to strengthen the team of the health family strategy with agents specialized in early child development. And we have to increase the places in childcare centers or nurseries, especially for those poor families. So families that are enrolled in the National Poverty Registry, Cadastro Único, that we have in Brazil. With all three policies that should be implemented in partnership between municipalities, the state, and the federal government. Then we can start to see a decline in inequality and an increase in intergenerational mobility. In Brazil, in the health systems, the municipalities are responsible for implementing the policies. The state do the same with hospitals, and the federal government do the planning and fund most of the programs. But we don't have such policies in education, and we don't have these programs in social assistance. So only with intersectorial and policies and partnership between different levels of governments, we will be able to grow more quickly, increase our productivity, and have more social justice, so that even those kids born in poor families, in poor regions, will be able to go on and study and go finish high school and go to higher education, and this will increase our productivity, and this money will return to the government through taxes and less expenditures on social programs for the next generation. So with that, I conclude. I thank you very much for the invitation, and I'll be here to answer some questions after the other presenters. Thank you very much.
Thank you, Naércio. Very good. We're going to have some questions in the end. Now I'm going to call Professor Agatha Sacramento Rodrigues. Thank you to be with us, Professora.
Hello. Good afternoon, everyone. It's really nice to be here. I'd like to thank Victor and Tamiris for the invitation. And I would like, okay, now can you share my presentation, please? Okay, thank you very much. So in this presentation, I will talk about the situation of maternal population in Brazil and presenting you the scenario of this population even after the COVID-19 pandemic. So I am the coordinator of Brazilian Obstetric Observatory, the OOBr, and me and Rossana Francisco that is here also, and maybe later you can talk more about our project. In this presentation, I would like to present to you the maternal health and COVID-19, the overview and lessons that we learned because of the COVID-19. So next slide, please. So in short, I'd like to tell you about the Brazilian Obstetric Observatory. The OOBr is an interactive platform for monitoring, analyzing public data, and disseminating relevant information in the area of maternal and child health. In special, during the COVID-19 pandemic, we have analyzed and monitored public data sets about the situation of the COVID-19 hospitalized maternal population. And the way you do that is by presenting the results in interactive dashboards, and also giving many interviews to national and international media. And one thing that I think it's really important to say is that the OOBr data supported the discussion to include the pregnant and postpartum women in the priority group for vaccination, COVID-19 vaccination. Okay, next slide, please. So now there you know what OOBr is. It's really important to say that OOBr studies are inserted in the Sustainable Development Goals, SDG 3. In special, when you talk about reproductive health, maternal, neonatal, and child and adolescent health. And in this presentation, we will discuss actions to reduce maternal mortality. Next one. So now I would like to discuss the scenario of the maternal mortality in Brazil. And for that, I would like to introduce you the maternal mortality ratio, the MMR. That is the idea is that Brazil has committed to the target of reducing the MMR to 30 maternal deaths per 100,000 live births. So that's the target of Brazil. It's the goal. It's our goal to get 30 maternal deaths per 100,000 live births by 2030. But unfortunately, we are really far from this goal, as I will show you next slide. Next one, please. In this plot, in this graph, I show you the maternal mortality ratio from 1996 to 2021. And the green, I don't know if you can see well, but the purple line, the purple curve is the MMR, and we have here the green dotted line is the global SDG goal, and the yellow line is the Brazil SDG goal, as I said before, the 30 deaths per 100,000 live births. And as we can see here, the green line, in fact, it's the blue one, is the adjusted MMR. What I mean by adjusted MMR is the MMR adjusted through active search for death of a woman of childbearing age. So what we can notice here is that we are really, really far from Brazil goals, and also far from the global goals. The global goal, as we can see, in 2021, the MMR is 117 deaths per 100,000 live birds. So it's really a huge ratio. And as we can see, the MMR in 2021 had a 100 increase when compared to the year of 2019. So it's really a very worried scenario. Next slide, please. And here I present you MMR by Brazil, the regions from Brazil. So we have here the targets, the lines are the targets, the goals. And what we can notice here is that the highest maternal mortality ratios are found in the north and the northwest regions, that are the green curves in the graph, with exception of the year 2021, in which the Midwest region in Brazil has the second highest MMR. So what's really important to observe when I show this graph is that, considering Brazil's goal, all regions are still far away of the SDG agenda. Next one, please. And now I present the MMR by Brazilian states. So in the map in the left, we have in 2020 year, and in the map in the right, we have 2021. And as we can see, is that from of the 10 states with the highest MMR in 2021, 70% are from the north and the northwest regions. And one thing that's really important to notice now is that Rio de Janeiro is the only state from the south or the southwest region on this list. So we can observe that Rio de Janeiro is in the 4th position. Okay, next one. And in this graph, I present you the cause of maternal death. So we have in this plot, in the green bar, we have indirect cause of maternal death. The purple is the direct maternal cause of maternal death, and the orange one is the unspecified cause. And what we can observe that in the year of 2021, when you had the most difficult year for the maternal population because of the COVID-19 pandemic, the number of indirect maternal death exceed direct maternal death for the very first time in Brazil, representing 66% of the total maternal deaths. Next one. And now talking about maternal death due to COVID-19. So in this slide, I show you that in the year of 2020, we had 460 deaths, maternal deaths, and just in the first 4 months of 2021, we had almost the double of this number. So as you can observe here, that 4 months of 2021, we had almost the double of the total death that you had in 2020 year. And it's really important to say that we had a 100 16% increase in lethality in hospitalized cases. So we have that we had a severe scenario for the maternal population in 2021. Next one. And when you observed that in 2021, we started in the OOBr started analyzing data about the maternal population during the pandemic. So in this paper that you published in PLOS ONE journal, we made a comparison between 2020 and 2021 year in order to say and to understand if in 2021 the maternal population had a higher risk of death due to COVID-19. And it's really, really important to remember that in the beginning of that year of 2021, maternal population was not considered as a risk group. And because of that, they were not considered as a priority group for vaccination. So it was really important in that moment to understand the situation of this population. So in this paper, we compared the both years in relation to three groups: pregnant and postpartum women, men, and non-pregnant and non-postpartum women. And we observed that despite all hospitalized patients in 2021 having a higher chance of developing severe outcomes, the maternal population had an even higher risk of death, nearly double of the chance of mortality compared to the other two groups. So in this moment, we observed that maternal population has had a really high risk of death due to COVID-19. Next one, please. And even when you're talking about the maternal population, we have two groups. We have pregnant and postpartum women. And it's really important to say that postpartum woman yet has a higher risk of dying due to COVID-19. In this second article that we published also in PLOS ONE, we notice that the chance of death of postpartum woman is more than 2 times higher than the chance of death of pregnant woman. And this is not a new information. Next slide, please. Because if you notice in this graph, you have the percentage of postpartum death among all maternal deaths. And as you can observe here, death of postpartum woman represent 74% of maternal death in 2021. So we'll have that even when you talk about maternal population, it's really important to think also and to think more specific to about the postpartum woman. Next one. And in this slide is the scenario of maternal death due to COVID-19 by year. So the data that you have analyzed from CVEP GRIP, there is a populational database related to hospitalized cases due to COVID-19 here in Brazil. So we have that in 2021, we have more than 1,500 deaths in 2021, with a case fatality rate among hospitalized cases of 13%. It's really a high fatality rate among hospitalized cases. But it's really, really important to notice here, and it's really worth noting that the beginning of the year 2021, that is prior to COVID-19 vaccination, was crucial for the high fatality rate during the year. And as I will show you in the next slide. Next one. This slide will have two graphs. And the graph in the left will have the daily cases, the daily hospitalized cases of maternal population hospitalized due to COVID-19. And in the right graph, you have the daily death due to COVID-19. And I don't know if you can see, we have a green line in vertical, and this green line is the moment that started the vaccination for the maternal population. So what I really like to show this slide, because you can see that in general, before the vaccination, that's the green line in vertical, when you have peaks in daily cases, you also have peaks in death cases. But after the vaccination, we have one peak in daily cases, as we can see in the graph in the left, because of the Omicron variant. Now you have this peak. But fortunately, because of the vaccine, this we don't observe this peak in death cases. That's another proof that vaccine really works. Next one, please. And here we have the analysis of maternal death due to COVID-19 by race and color. And what you will notice in our project is that the chance of death for people from Black ethnicity is 72% higher when compared to white people. And from people from mixed ethnicity, the chance is 31% higher. So we have another important result when you talk about ethnicity, is that we have people that are in a situation that they are more in vulnerability. Next one. And we also published another paper when we studied the effect of COVID-19 vaccination. So in this article that we published in Vaccine Journal, we noticed that having received the COVID-19 vaccine reduced the chance of ICU admission by 46%, and also reduce the chance of requiring invasive ventilatory support by 81%, and also the chance of death from COVID-19 by 80%. So another proof that vaccine is really important to avoid these bad outcomes. Next one. So another thing that's really important, and what we also observed monitoring this maternal population during the COVID-19 pandemic, is the weakness of the healthcare system and the impact on maternal mortality during the COVID-19 pandemic, is that we noticed that the time interval from symptoms onset to hospitalization was on average in 6 days, and we also observed a delay in providing intensive care after hospitalization. So this data, it's really important, because we notice that 20% of pregnant and postpartum women who died did not have access to intensive care unit, and also 31% of this pregnant and postpartum women who died also did not have access to intensive ventilatory support. So it's really important to notice that these women died. So it was really expected that if they could have access to ICU and also to intensive ventilatory support. Next one. And in these two maps, I also show that we have a high inequality in access to healthcare service among Brazilian states, and that the lack of ICU as access among human who died ranged from 0 to 43%, and also the lack of intensive ventilatory among women who died ran up to 48%. Next one. So some lessons that we didn't learn from H1N1 pandemic, because we had this pandemic and it was expected that you should learn some lessons from the previous pandemic to the COVID-19 pandemic. But despite the severity observed during the previous pandemic, and the knowledge of systematic chances during the pregnancy, this group of women was not initially considered at risk in the beginning of the COVID-19 pandemic. This fact delayed the organization of service for the care of this population and also the availability of vaccines, which may contribute to the high number of maternal deaths. And it's really also important to say that just 30% of pregnant women hospitalized with severe acute respiratory syndrome has a record of being vaccinated against influenza. That's really a really low number. Next one. And some lessons that we learned from COVID-19 pandemic. We have learned some lessons, and some of them are that specialized ICUs for the healthcare of pregnant and postpartum women are necessary. The importance of open data. It was really important in Brazil to have access to populational data that you could monitor in real time the situation of Brazilian population during the pandemic. The importance of a multidisciplinary team, people from obstetrician, people from statistics area and things like that. And also the importance to talk to the society, the importance of dissemination of scientific data, the importance that researchers can talk to the society, can talk to the society and to present their scientific data and informations. Okay, next one, please. And also some recommendations to achieve the reduction of maternal mortality is a fast response for the care pathway, maintenance of essential service like prenatal care, contraceptions in the legal abortion, and prevention campaigns, vaccination, and public awareness campaigns too. Next one. So all this data, all this information, and all these studies that are presented, you can find in our project, the Brazilian Obstetric Observatory. Nowadays, we have set interactive dashboards that you can access data from different areas here in Brazil, from SINASC, the system that of live birth from SIN, a database about people that died and things like that. And also in our site that I show in next slide, you can see the Aparecida story about the vulnerability of a woman in Brazil. So thank you very much for your attention. I didn't told you in the beginning, but I am a statistician. I am a professor in the Federal University of Espírito Santo, and it's really a nice pleasure to talk to you about our project, and you can find us in our social media. Thank you very much.
Thank you, Agatha. Very good. And you said in the end that you talked about vaccination. And now we're going to have Doutora Karina de Cassia Braga Ribeiro. She's from our new partner, Sanofi. We're very glad to be with them here in Santos, São Paulo. Karina, thank you very much.
Well, good afternoon, everyone. Thank you, Victor. Thank you, Tamires, for the invitation to take part in this very important initiative and very important activity as part of this huge forum to discuss the progress towards the achieving all the SDGs. So if you can share my presentation, please. So my name is Karina Ribeiro. I am epidemiology, and I'm currently the epidemiology manager of the vaccines unit at Sanofi, Brazil. And I will talk, of course, about the role of vaccines and the SDGs that are related to vaccines among children in this context of the Agenda 2030 and the future of children in Brazil. Next, please. So the SDG number 3 calls that we need to ensure healthy lives and promote well-being for all ages. And then we have several items, several targets, and one of them is the 3B that support the research and development of vaccines and medicines for the communicable and non-communicable diseases that primarily affect developing countries, etc. And then we have as one indicator the proportion of the target population covered by all vaccines included in the national program of each country. Next, please. So based on the reports of what we have achieved until now, we know that unfortunately more than 22 million children missed basic vaccines in 2020. And this is a number that is 3.7 million higher than what was observed in 2019. And then we know that the percentage of children who received 3 doses of the vaccines against diphtheria, tetanus, and pertussis fell 5 percentage points between 2019 and 2021 to 81% of drop, causing the largest sustained decline in childhood vaccinations in approximately 30 years. So this is a very concerning situation, and we will discuss a little bit about this. Next, please. So I will bring the attention to Brazil to show you what is happening in the country regarding vaccination and vaccination coverage. This is a topic that constantly are being spread in the media and the news, but not even with all these advertisement or negative advertisement, we don't see like our vaccination rates as model as we used to see in the past. Next, please. So this is kind of a flavor of our vaccination schedule. So all the vaccines that are available for free in our public health system, since vaccines that are given at birth, like tuberculosis vaccine and hepatitis B, up to the vaccines that are given in the children less than 1 year. So vaccines for tetanus, diphtheria, pertussis, polio, rotavirus, meningococcal disease, influenza, yellow fever, mumps, measles, and rubella. And then after the 15 months and 4 years, we have like boosters for some of the vaccines and the vaccination for chickenpox. Next, please. So it's a very comprehensive schedule, but we can see that even with this offer and the increase in the number of vaccines that are offered over the years, we have a very sad information that among the 15 childhood vaccines, 12 don't achieve the goal of vaccination coverage of 95% of the population coverage since 2016, and no vaccine achieved the goal since 2019. Next, please. And I will bring the attention to the specific example of the DTP, diphtheria, tetanus, and pertussis containing vaccine. We have a pentavalent vaccine today in Brazil that these 3 vaccines protecting against these 3 diseases plus Haemophilus influenza, and plus hepatitis B. And then we see that the percentage of children receiving the 3 doses, what we call the primary schedule, with doses at 2, 4, and 6 months, the 3 first doses, this number has decreased in Brazil. Brazil is the black line. We used to have 100%, and we drop to 68.4% in 2021. As a matter of comparison, we have this blue line showing all the region of Americas, where we still observe a decrease, but the most updated estimation is higher than that observed for Brazil. So, and we see this orange that is the world, where we also see a decrease, but the decrease in Brazil was more pronounced. Next, please. And then we have this information in Brazil by city, and I try to map, and I managed to do it. So each one is more. Brazil has more than 6,000 municipalities, and you can see here that the overall vaccination coverage for this vaccine, for the pentavalent vaccine in the country, was 77.2% last year, 2022. But when we map for each city, you can see here that there's a huge variation. And I can tell you that the dark blue, the very dark blue, they are the lowest vaccination coverage rates, while the most clear green is the highest. So you can see that in the north region of the country, unfortunately, we have a very concerning situation with very low vaccination coverage in some cities under 50%. Next, please. And then I have calculated the difference between the vaccination coverage that was observed in 2013 and that observed in 2022. And we estimate a decrease in terms of percentage comparing one year to the other. When I look at the whole thing for the country, we observe that for pentavalent vaccine, we have a decrease in the country that was approximately 20% decrease in vaccination coverage for this immunobiological. But you can see again that the dark blue are the highest negative variation, so the highest decrease, while the green, the light green, is the lowest variation, the lowest or even the increase in vaccination coverage. That is our goal, what we aim to do it. And again, you can see that in not only in the north, but calls the attention the situation of the north, but even some big cities in the south and southeast. And you can see here that then we did a very like a simple indicator, just showing which city in which state has a decrease and which city has no decrease or has an increase, the improvement in vaccination coverage. And we observed that 67.6% of all Brazilian cities presented decrease in pentavalent vaccine coverage in this period of 2013-2022. The highest decrease was observed in the state of Rio de Janeiro, where 84 out of the 93 cities from this state presented a decrease in vaccination coverage for this vaccine. And the lowest decrease was observed in Alagoas, where we noted that 44 out of the 102 cities in this state presented a decrease in vaccination coverage in the period for the same vaccine. Next, please. And then we always want to see how this correlates with socioeconomic measures, with economic development. And then I just took a very simple index, human development index for each city, and I classify it using the classical classification of low HDI, medium HDI, high HDI, and very high HDI. And then we calculate how many cities have achieved the goal of vaccination coverage. And then we observed that in 2013, among the cities of low HDI, 46% of them reached the goal for vaccination coverage for pentavalent. 62% of the cities classified as median HDI reached the goal for penta in 2013, 67% for high HDI, and 38.6% in the cities classified as very high HDI, the most developed cities in the country when we classify based in this indicator. But look, pay attention on what happened in 2022. So for cities of low HDI, we have a decrease, but it is not huge. Now in 2022, 82% of the cities in this category reach the goal. But take a look on what happened with medium, high, and especially with very high HDI cities. So right now in 2022, only 4.5% of the cities in this category have reached the goal of vaccinating 95% of target population of the children with pentavalent vaccine. Next, please. And then I try to make a focus on these cities. So there are 44 cities classified with very high AGI in the country. And then we see that only 2, Jaraguá do Sul and Rio Fortuna, they reached the goal. So you can ask me, well, how come the vaccination coverage be higher than 100%? This sometimes happens because many times parents from neighbor cities bring a child to vaccinate in that city, and then we will have a number higher than 100%. But then take a look on these cities here. So Taubaté, Ilha Solteira, and São Paulo, the capital, 68% of vaccination coverage with a huge number of live births each year. So more than 130,000 children born in the year of 2022. So take a look that it's not, it's a mix of small cities and also big cities too, and a problem that we need to take into consideration, especially regarding the access to vaccines. Next, please. So because of this decrease in vaccination coverage, the Ministry of Health has planned a vaccination coverage survey. This study was coordinated by Dr. José Cássio de Moraes, who is a professor at Santa Casa Medical School in São Paulo, Brazil. And then this is a slide that he presented in the Congress here last year, showing the reasons to not vaccinate a child. So this study was conducted in the Brazilian capitals and the federal district, and the number of children that they were not vaccinated is like almost 1,500 children. And the main reason for not vaccinating was the pandemics by the time they interview. But the second one was fear of adverse events. And then you can see that the third one, for example, is that the doctor or other healthcare professional has advised the family to not vaccinate the child. So we need to think about to give like a safe messages to improve our communication, to show people how vaccines are important, to show strategies to facilitate that children are vaccinated. We cannot miss opportunities, and we have to have options of vaccines that are like efficient and safe, and if possible, using combined vaccines to decrease the need of going multiple times to the healthcare units, and also to decrease the number of injections in a child, because many parents, they said that they have like a 90% declare that they didn't vaccinate because they have fear of injection. Next, please. And then let's talk a little bit about other very important public health problem. Many times people forget about polio, and Brazil, unfortunately, is classified as one of the countries with a high risk of like having the disease again. And you can see here that our vaccination coverage has dropped importantly since 2015. So each year is dropping more. Next, please. And then last year, there was a campaign trying to recover the vaccination coverage rates using the oral polio vaccine. But you can see again that unfortunately was not very successful. So 7 cities in the country had 0 doses applied in campaign, and only 928 cities presented a vaccination coverage rate higher than 80%. So this corresponds to less than 17% of all Brazilian cities. So here again, the blue one is the bad situation and the red one is the good situation. So pay attention that even in the south and in southeast, in the coast, that where we have very developed cities, the thing about the vaccination coverage in this campaign was not successful. Next, please. But we present the problems and we need to present the solutions. So one of the SDGs that was not the topic of my presentation, but is important and will be discussed, is the partnership for the goals. Next, please. And then we have, as a enterprise, I'm sorry, to to support initiatives of investigation, we are promoting an epidemiological study to assess how adverse events after immunization can affect the parents' lives, and also an investigation project to assess vaccination coverage rates for preterm babies. Preterm babies, they have the right of receiving special vaccines in special centers called centers for special immunobiologicals. And also, very important, this initiative to educate healthcare professionals about vaccination schedule, about special populations, and to educate healthcare professionals and to support vaccination in cities at risk because of a combination of low vaccination coverage rate and high circulation of people. This actually is the project of this new partnership we are developing with Abrinq. And this is just one part, a small part of many initiatives and part of our commitment as citizens and as workers and as people and as a company producing vaccines to increase the vaccination coverage in the country and to improve the children's lives. Thanks so much.
Thank you. Guilherme, I'm gonna ask you just 2 minutes, because Professor Naércio need to leave a little bit. And so I'm gonna, Naércio, we have 2 questions for you. And so do you have time to answer those 2?
Sure.
Okay, so do you think that education in Brazil got better before COVID and got worse against post-COVID? What do you think the government can do about it?
Yeah. In terms of access, education improved a lot in Brazil in the last 30 years. But in terms of quality of education, learning, it has improved. It has not improved in the same pace. So we only had improvements in the 5th grade, but the 9th grade and the high school grades are still stagnant. So there hasn't been much improvement in high school. After COVID, even the 5th grade learning has decreased as well. So the kids were impacted substantially by COVID. In the 1st grades as well, literacy has declined, and the learning in the 5th grade has declined as well. And a recent international study amongst 10 years old all over the world has shown that learning in Brazil is quite low, even in the early years, contrary to what we expected from national evaluations. So we have a huge challenge ahead in terms of improving quality of education. I think this is the main bottleneck of Brazil with more social justice and not leaving kids behind.
Thank you, Naércio. Thank you to be with us, and thank you, Guilherme. Guilherme, it's our friend from Rubens, Naves, and Santos Jr., but more than a lawyer, he's a friend. Thank you, Guilherme, to be with us.
Thank you, Victor. Good afternoon, everyone. I would like to thank Victor once more, Tamires, and the Abrinq Foundation for inviting me to be here today. I am a partner and lawyer at the Rubens Naves Santos Jr. law firm, and I have been a university professor for over 25 years. Currently, I am dedicated to constitutional law at FADISP Law School. I have been tasked with speaking about the challenges that the COVID-19 pandemic has brought to achieving Goal 17. The pandemic has brought enormous health, environmental, and financial challenges, especially for developing countries. Initially, we noticed that the health crisis led to a redirection of countries' attention and resources towards emergency actions to combat and contain the effects of the new virus. As a consequence, there has been a significant impact on the implementation of Goal 17 due to the decrease in foreign investments and collaboration from developed countries to support sustainable actions worldwide. This impact has been felt by governments, private institutions, and organized civil society, who have faced difficulties in implementing their social projects and programs. Additionally, the imposition of distancing and social isolation measures to contain the spread of the virus has led to the closure or limited operation of many schools and daycare centers in early childhood education, for example. These restrictions have made it challenging to hold in-person meetings and events, which are crucial for fundraising and other incentives for social development projects, as we know, and for establishing and strengthening local and international partnerships. However, it is important to recognize that alongside this scenario, the crisis has highlighted a spirit of global solidarity, focusing particularly on the needs of the poorest and most vulnerable, and involving the participation of governments and various civil society organizations in overcoming the effects of the crisis. Many of these organizations have historically been at the forefront of the fight for the realization of rights and guarantees and the construction of more just, equal, and sustainable societies. To make this analysis more concrete, I bring the example of a judicial action decided by the Brazilian Supreme Court, which addresses the realization of basic education in Brazil. I specifically mention Recurso Extraordinário number 1008166 from the state of Santa Catarina. The Brazilian Federal Constitution defines early childhood education as a fundamental right in its Article 208, meaning it is a basic and indispensable right for ensuring human dignity, freedom, and equality, and therefore receives constitutional protection. Our Constitution establishes the state's obligation to guarantee the first stage of basic education for children from 0 to 5 years old, through access to daycare and preschool education. This prerogative was also enshrined in the text of Federal Law 8069 from 1990, which consolidates the Statute of the Child and Adolescent. Despite the constitutional provision, the recognition of the government's obligation to fully enforce this right is the result of the civil society's struggle. In the mentioned judicial action, the civil society was represented by the Abrinq Foundation, which acted as an amicus curiae before the Supreme Court. The debate was conducted with the centrality and sensitivity that the topic of early childhood education requires, especially considering its relevance to the Sustainable Development Agenda linked to the care of future generations. In this understanding, I bring an excerpt from the vote of the reporting judge, Justice Luis Fux, which states, and I quote, inverted comma, in early childhood, access to quality early childhood education is essential to seek, through the exercise of care, education, and attention functions, the formation of essential components for the comprehensive development of children, so that they can actively begin to build knowledge about themselves and the world around them. Through monitoring the issues addressed in court cases, the Supreme Court has been organizing the proceedings according to the Sustainable Development Goals, SDG. This is very interesting. In the cited case, the thesis was aligned with goals number 1, no poverty, number 4, quality education, number 10, reduced inequalities, and number 16, peace, justice, and strong institutions. But what does this discussion have to do with Goal 17, which deals, as mentioned before, with partnerships and means of implementation? We can see Goal 17 as a catalyst for the other goals, since they can only be achieved through strong global cooperation and the establishment of partnerships at various levels. Let's return to that example. The right to access early childhood education is provided by the Brazilian Federal Constitution and has recently been ruled as a duty to be fulfilled by the public administration. However, based on the premise that financial, structural, professional, and operational resources are scarce, especially in countries of lesser relative development like Brazil, it is essential for the government to consider alternatives when there are no conditions to fully realizing this social right, define it as crucial to the sustainable development of the country. In this context, to achieve the goals of the 2013 Agenda, the involvement of the United Nations, national governments, supranational entities, private sector, academia, and especially civil society is required. It is along these lines that Goal 17 is split into various actions like targets 17.16 and 17.17. These targets have been defined. Let's take a look at them. 17.16, enhance the global partnership for sustainable development, complemented by multi-stakeholder partnerships that mobilize and share knowledge, expertise, technology, and financial resources to support the achievement of the sustainable development goals in all countries, in particular developing countries. 17.17, encourage and promote effective public, private, and civil society partnerships, building on the experience and resourcing strategies of partnerships. Considering the current times and the challenges left by COVID-19 pandemic, the realization of global and multi-sector partnerships involving public and private actors in the participation of civil society becomes even more necessary and urgent. The government lacks the material conditions to meet the diverse sectors of society. A shortfall that can be addressed by the knowledge, expertise, technology, and resources held by civil society organizations and through the mobilization to execute partnerships aimed at achieving common objectives. As an example of initiatives by Abrinq Foundation, we have the call for proposals to select working groups on issues related to childhood and adolescence in the country, aiming to support the development of locally impactful social activities. Additionally, the European Union, as a key supranational institution, is one of the funders of the strategic SDG network strengthening project of the Abrinq Foundation. This project seeks to expand and enhance the capacity to coordinate and mobilize initiatives aligned with different goals in Brazil, including programs aimed at reducing gender inequalities, promoting human rights, assisting individuals in socioeconomic vulnerability, among others. In the current COVID-19 scenario, actions aimed at sustainable development and cooperation among nations have gained prominence as means to mitigate the impacts generated by the pandemic. Therefore, we can see the current phase as a window of opportunity to think about new ways of achieving sustainable development goals, particularly by strengthening global and multi-sectoral partnerships at various levels. The involvement of civil society organizations in essential sectors during the crisis has placed them in a position of relevance alongside state actors in national, regional, and multilateral relationships. We need to seize this momentum of valuing cooperative actions to raise awareness among nations and mobilize the necessary means to implement a revitalized sustainable development agenda focused on the promotion of partnerships, integration of knowledge and financial, professional, and technological resources, and increase the involvement of civil society in process of a change. In concluding my speech, I would like to thank my colleague Suzy Fuji for her support in this research, and also everyone who is listening and watching this presentation for their patience and attention. Once more, thank you very much.
Thank you, Guilherme. Thank you very much. So we have 3 minutes more, so I have some questions in chat. Agatha, do you see any ways by which NGO could help bring attention to MMR prevention?
Can you hear me?
Yes.
Okay, great. So yes, I see some ways that NGOs can help. One thing that I observe is the importance that the importance of disseminate information. So during the COVID-19 pandemic, we realized that providing data is a way to drive change, and in the communication and to disseminate this kind of data, it's really important to do that. So NGOs can help us with that, with this communication with the society. And one thing that's really important is to remember and to know that maternal death usually occurs for 3 delays. The first one is the delay in recognizing the emergency situation. And the second one is the delay in reaching a suitable hospital for treatment. And the third delay is in having the diagnosis and treatment in a timely manner. So we understand these 3 delays, and if you can fix them, we can so reduce the maternal mortality. So I think it's the way that NGOs can help raise the awareness about MMR prevention.
Good, thank you, Agatha. Karina, let me try here. I saw that, and I don't know the name in English, so I don't know if it's drop vaccine polio, a vacina da polio em gotinhas. Parece que gonna be out of the calendar. Do you think it would be a problem because of the fear of the injection? And other thing, we have the culture problem, the haters in the internet, but do you think access or no access to vaccines is still a problem?
I think that this is a very complex situation. There are like the reasons for what we call vaccination hesitancy are of like several sources. If you remember that table that I show, there are fear of adverse events, fear of injection, HCPs, and many times family saying, please do not vaccinate, vaccines are not safe. There are fake news. And also, we know that there are problems of access. That, for example, the hours that the healthcare units are open, for example, for single mothers working, they cannot take the child. So there are multiple things. So we need to work. There's no single solution to solve this problem. We have to work on multiple things. So we have to work increasing the access. We have to, when we make the campaigns, they cannot be like one of our authorities in vaccines, Dr. José Castro, says we cannot have secret campaigns. So we need to put these on the media. We need to use the media in our favor. Regarding the OPV, because we have 2 types of polio vaccine, the OPV and the IPV. If you have low IPV coverage, giving too much low IPV coverage, if you give too much OPV, this is a problem, because the IPV is a vaccine with inactivated poliovirus. And the OPV is a vaccine with live attenuated virus. So there is a problem called circulating poliovirus derived from the vaccine, because you can excrete the virus present in the vaccine, and this can go through the sewage. And the transmission of polio is oral fecal. So it's quite concerning, and we are nowadays the only country in Latin America still using OPV. There are arguments in favoring of OPV, and one of them is a little drop, is easy, it's not an injection, etc. But there are problems if you don't have the good coverage of IPV. And many countries worldwide, they have switched completed to all doses of the IPV. And when you have the opportunity, and this is already offered, for example, for special populations in the CRIs, for the preterms, for children with comorbidities, to have like a vaccine that is 6-in-1. So you only give one shot. And this is the trend for the future. Try to combine as much as possible with the new technologies a lot of vaccines in one vaccine, because it's easier, is one time the mother goes there, is one shot, and so it's easier to reach the goal.
So it's culture, it's access, and all it says that there's no silver bullet to solve the problem.
No, we need to work in all fronts.
Yes. And Guilherme, we are now with different government, and we're talking about partnership and advocacy. Do you think we can go back to the track related to child rights with this new government?
I think we can. This is a new scenario. This new government is trying to reestablish a new understanding with the countries, especially with international governments. It's necessary to understand, Victor, there is a new window of opportunities with what we call the supranational entities, like the United Nations, like the UNICEF, like this kind of representation, because it's very important to articulate. It's very important to create spaces of debate, to bring not only Brazil, but other nations, other countries, to amplify opportunities to investment, changes of knowledge. Because after pandemic 19, it's not exclusive from Brazil. Difficulties with education, health crisis, lack of investments in health technology. Brazil is struggling with this, but other countries is also struggling. So it's necessary to create spaces of debate and spaces of opportunity to investment among countries and among private partners.
Thank you very much, Guilherme. Also, again, I want to thank the speakers, Naércio, Karina, Agatha, and Guilherme. I want to say thank you again to our team here, Tamires, and thank you very much for your information. And it's the end of this session, but we will be together again in October the 3rd. Thank you very much.